nice to meet you here. You know, after my tread lift procedure, I actually received a lot of enquiries about and questions about it. Do you think you can spare some time to answer these questions?
Yeah, sure. Do you want to come to my clinic?
Sure.
I can show you some stuff.
Okay. So, doctor, here are some of the questions that I've actually received ever since my tread lift procedure.
Oh, okay.
So, Dr. Tan, what exactly is a tread lift?
Okay, so a tread lift sounds really complex, right? And a lot of people are actually, frankly, quite scared of it, but actually it's a very simple procedure. It's very simple. It's just using clean, sterile surgical threads to lift or to recontour the face or the neck. So that's all that it is. It's quite confusing because there are quite a few brands out there, and there's also quite a few materials. But one of the most commonly used materials out there is PDO. So a lot of people say PDO, PDO, PDO. So it's actually a material. It's called polydioxanone. So polydioxanone is just a material that's used in normal surgery, but adapted for tread lifts. They mainly come from Korea, and there are various brands out there. But the brand we use is Enfinders for two reasons. Number one, Enfinders is the market leader in Korea, and also more importantly, it's approved to be used in Singapore. So there are various benefits to using this. Do you want to have a look at it?
Oh yeah, sure.
Okay, so this is how the material looks like. Okay, so this is a short one, one that we use for the nose. If you look very closely, you can actually see small little hooks on them, but they are so small that you hardly notice them.
Oh my.
And it wouldn't cause any problems. You want to try?
Okay,
Put your
yes.
finger here, just grasp it like this, and when I pull, you can feel.
Oh,
Yeah, it's a little bit rough, so it's very, very good for traction when you need a little bit of traction, and it keeps the threads exactly where you want it to be.
Oh, okay.
Not so scary, right? Okay, so the next thread that we actually do like to use very much is called Silhouette Soft. Now, Silhouette Soft is American, as opposed to the Korean threads, which are made of PDO. The main difference between this and Silhouette Soft, or rather the main difference between Silhouette Soft and PDO threads, is that instead of small little hooks that you felt just now, it uses cones rather than hooks.
Cones?
Yes, small little cones. The cones look like this. And this is a very blown up picture of the cones, but they're really, really tiny. It's a little bit like the size of those hooks, except that it's a cone. So it is slightly better in lifting, and it's also made of this material called PLLA. So PLLA is actually short for poly-L-lactic acid. Lactic acid is that stuff you find in your muscle when you go exercising, which I'm sure you do a lot. So it is very good as a collagen stimulator because it is also the same material as a filler called Sculptra. Some of your readers might know Sculptra, and that it's actually a very famous filler. It uses the PLLA for collagen stimulation, for volumization. But in this case, after putting that thread and lifting, it has got very good collagen stimulating properties in order to improve the lift and improve the longevity. So there are various benefits of both Silhouette Soft and PDO threads or Enfinders. And different people have different requirements, different people have different preferences, and so different people would request for different threads, and we would propose different threads to different people.
So I think the question really is, where can we put these tread lifts? Because I think there's like, some people think it's only for saggy skin and all that, right?
Yeah, well, it's not true. It's true and it's not true. I mean, it is fantastic for anti-aging, but at the same time, it can also be used for contouring in other areas. Come, let's have a look at it together. You want to hold this?
Okay.
Okay, so we can put it over your brow area or forehead area.
Oh, we can do that also?
Yeah, that's right.
Oh.
For a brow lift like this. It is also very, very good when it's applied underneath the eye. So whether you're young or you're not so young, sometimes we are always concerned with eye bags, which we might have had since we were young, some fine wrinkles for people who are slightly older. And it's actually a very, very common complaint. In fact, it is probably the most common complaint, or the most common issue that people have. And Dermaspring under eye, which is actually a PDO thread, is really one of the top procedures that we do for this because it is nice and safe, and it gives a nice support underneath that skin in order for the wrinkles and in order for the eye bags underneath to look better. So a lot of people are really scared.
Yeah,
they
like
say,
underneath the eye?
Yeah, that's right. So unfortunately, although this is such a good procedure, sometimes people choose other less invasive procedures. But actually this is perfectly fine. It's actually very, very safe. It uses a cannula, and it is, the chance of side effects is very low. Most people have no downtime at all, except, well, I think once in a long time, sometimes bruising can occur. But most people, after putting it on, can go back to work. So I think that's okay. Then thereafter, we can do it on the nose, which I think you might know.
Yeah.
So it's good for sharpening of that nose so that you have a well-defined nose. Yeah. And probably most of your readers would think about when they think of threadless, which is really to lift the cheeks at the side, just to give it a little bit of lift. Some people do it for anti-aging, but some people do have quite a lot of fat even when they're young. It's also good for just contouring the cheek fat a little bit. And lastly, we can also do the neck just to give it a little bit more definition. A lot of us Asians, we tend to have very short chins, and because of that, we tend to have a neck which looks a little bit saggy, and that's really good. Whether you're old or you're not so old. There are also other areas, whereby you can put for fine lines, for small wrinkles, but generally those areas are where we use threads.
Oh, okay. So are there any risks involved in thread lift?
Yes, I think no matter what we do, there is always a small risk that things can go wrong. But this risk is really quite minute now. When we put in a thread, we must make sure that we clean the area very, very well with disinfectant. The threads that we use must be well sterilized and put in sterilized containers, and everything must be very clean. So one funny thing when we do thread lifts is that commonly people are afraid of side effects, so they say, oh, please clean very well, make sure that there's no infection, which is what we do. But we clean so well because we use sterilized equipment and we drape them very well. As we are cleaning, people get very scared. They go, oh, why are you cleaning so well? It feels like a surgery. But we need to do that in order to make sure that it's nice and safe. So we don't know whether we should clean well or don't clean well. If we clean well, people get scared. We don't clean well, obviously that's not going to happen, but we want to prevent an infection. Some people, they come and they actually go to beauticians and they have thread lifts done. And it's hard to imagine them using sterilized equipment, same equipment that we have. So I would warn you, your readers, or anybody who's considering going to a beautician for a thread lift to really think twice. Yeah, because we really, really want to make sure that it's nice and clean.
What is the difference between like thread lift and a filler treatment?
Okay, so thread lift and filler, they are quite different. Filler,
because I understand that fillers can lift up areas as well, right?
Yes, it can. But aging is actually due to two main processes. And one is that the skin becomes a little bit loose. And the other one is that we actually lose some volume. Either we are born with a little bit less volume in certain areas, or we have got less volume as we age. Common areas are over here and over here. So thread lifts are a little bit better for skin tightening through collagen stimulation. Whereas fillers, which look like this, it's better for volumization, which is really to apply underneath that skin in order to lift it up from the inside. So one pulls from the outside, one lifts from the inside. Actually, they work well together, and it's not so much one or the other. Yes, that's right. So to tighten from the outside, we get a nice tight skin, but to increase the volume from the inside, we actually have like a sandwich of the fat in between. They give this nice, flawless, boing boing kind of, effect that you have on our skin.
Okay, so I just want to ask, like, let's say if it's for an under-eye treatment, how do we use filler and thread lift together?
Okay, so first of all, when we have got, let's say, okay, maybe have a look. Okay. We always have a combination of lack of volume, which you have a little bit of over here, and fine lines and loose skin over on top. So if you're going to put the filler, we're going to apply the filler. Yeah, when you smile again a little bit. Yeah, what a filler does is exactly like this, to increase that volume over this area in order to lift. But sometimes the skin over on top is still very loose, and increasing the volume can cause lumpiness if we do too much. So from the outside, we sandwich it by putting the threads just underneath the skin in order to give the skin more support. So once again, we have got a sandwich. From the outside, we tighten. From inside, we fill.
So it's
for
like
very, very nice rejuvenation. That's right. It's like it's smiling and pulling at the same time. Easy, right?
If threads can be used to lift your saggy skin, when will you decide to use thread lift as opposed to other rejuvenation treatments like the ultra therapy?
Therapy? Yeah.
Is that how you pronounce it?
No, it's actually out therapy, but it's okay. I mean, most people call it ultra therapy because it's really quite a tongue twister. Yeah. So no matter what you call it, I think that's fine. I think they're both similar in terms of the fact that it's actually used to tighten skin, but the way it's done and how fast the results come on is quite different. And generally, the people who come for a thread lift would not really be looking for our therapy, and the people coming for our therapy are generally not looking for a thread lift, because and precisely what we're doing today, we are actually trying to let your readers, your viewers know what is this all about, so they can make an informed decision before they come. So a lot of them, when they come, they already know what they are looking for and they want. But generally speaking, our therapy is good for a general improvement, a general tightening of that skin with minimal downtime. Because it uses ultrasound to tighten skin, it tightens from way inside, so there is no redness, no swelling after the treatment. After the treatment, they can go back to work, and it's all very good, but it takes a little bit longer because no injections, nothing goes inside. It works through collagen stimulation, and collagen stimulation, by and large, takes about 3 months, and sometimes
that's
even
a really
longer.
long time.
That's a really long time, but it's good because it actually reverses the aging process without the need for injections, and just some people just don't want it. I think that's fine. I mean, that's really a personal choice, yeah. And because it's done over the entire face, it's a general rejuvenation. Whereas for threads, it's more specific to where you put that thread, where your concerns are. My concerns are here, I can put it here. Concerns are there, I can put it there. Here, I can put it here. And it's really more specific to the place that you want to put it. That's number one. Number two, it is a slightly bigger procedure, so there might be a little bit of swelling after that. The chance of bruising is slightly higher. So maybe for most people come, let's say on a Friday, and on Monday they can go back to work. So they have to take maybe just a little bit of time off if they're a little bit self-conscious. Yeah. So that's really the main difference. And the results are a little bit faster because on top of collagen stimulation, which it does, it also has some immediate effect through those cones and those small little hooks that you have seen. So they're a little bit different.
So are there any precautions that we should take before and after the procedure?
Yeah, okay, so for thread lifts, we have to inject some local anesthetic before we start. So try not to take any painkillers or any anti-bleeding medications like painkillers, aspirin, some people have heart conditions, they are on some anticoagulants. So all those try to avoid. Some supplements also causes a little bit more bleeding. So like vitamin E. So generally maybe for that day or the day before, try to avoid supplements which are high in vitamin E. Some Chinese medications like I think Lingzi also does have some mild anticoagulant effect. So basically try to avoid that. Then during the treatment, of course, just leave it to us. But after the treatment, I think it's also important not to rub the area too much for about a week or so. Because it takes time to stimulate collagen and for it to set. We don't want to disturb it too much within the first week. But I mean, we can use common sense on that. Some people ask, I cannot massage it, so I can't touch it. Today I don't wash my face. I sleep, I make sure that I don't turn my head. I think these are a bit too much.
Initially,
That's common
I thought
sense.
I couldn't wash my face as well.
Yeah, but you can wash your face. Just don't consciously try to rub the areas that is treated. I think that's it.
Yeah. So Dr. Tan, how long does a thread lift usually last?
Well, the material itself lasts between maybe about 9 months to about a year and a half, depending on which thread lift you use. But it also has some longevity to it in that it also stimulates collagen. Even after it's gone, some of that collagen still persists, increasing its longevity. But for most people, we will say maybe let's just do it once a year, because although the treatment may be very long lasting, we do have sagginess every year, and it's good really just to refresh ourselves every year. Now, I think that is very important because nowadays threads are fully absorbable, as we had said, and fully absorbable threads, although might seem like it's very short acting, it actually uses collagen to prolong its effect, and that's good because generally collagen which is stimulated gives a very natural enhancement and a very natural lift, and that's what most people want.
Okay, so are you saying that if I do a thread lift now, I won't have to remove it in the future?
No, you don't have to remove it.
Oh.
Yeah, so I think that's really good. I mean, this is one of those main things that have improved over the years.
So can the thread lifts actually be seen or felt?
No, it cannot be seen, it cannot be felt.
That is quite true.
Well, I guess if you really press very hard, you might be able to feel it initially. But modern thread lifts, actually they come in a cannula. So cannula is actually not sharp. And because of that, it cannot be inserted too superficially. And the previous threads were actually mounted on needles. And because needles are totally sharp, sometimes when threads are put inside the skin rather than underneath that skin, yes, lumpiness and even puckering, and you can actually feel the threads. But with modern techniques, with modern equipment, with cannulas, no, I don't think that's likely to occur. It's quite amazing how much the thread lifts and its technology has improved over the years. Previously, threads used to come mounted in sharp needles, and the materials was not as long lasting and did not lift quite as well. So bruising was more likely. They didn't lift as well, and they didn't last as long. So threads are very popular right now, but for a good reason, because threads are better right now, and when people see better results, yeah, I think more people will be asking for them.
So Dr. Tan, thank you so much for your time in answering all my questions.
No problem. Yeah, I think it's good that we had this session because your readers are obviously very curious, and it's good that we inform them, demystify what thread lifts are and how easy it's actually done. Yeah, so thanks for coming.
Okay, I'm so glad I bumped into you today.
Okay,
Thank
bye-bye.
you.